will vote to repeal the healthcare vote. And that bill to try to turn that back around. And then the next one that's coming right after that is then a replacement. It sends a priority to all of the leadership and all the committees to say, here are the major issues we need to get started on this. I am a co-sponsor of the bill to replace, though, and I will be a co-sponsor of the bill to repeal coming up next Wednesday. The replace bill is very simple. It just outlines to each of the committee chairmen and all the applicable committees to say these are the major issues. We know them well. There are lots of problems in the healthcare delivery right now, so we just need to be able to outline these and say get started on finding out solutions. What we know is the healthcare law that we have now, we're already seeing insurance rates rise. We're already seeing all the problems. We're already seeing companies drop out of the market. There are major issues. These are the things that Republicans were saying 2 years ago. Now they're starting to occur. So we see what's happening. This is a bad law. Let's get rid of it. That's the first piece. And the second piece is let's get started on a real free market solution.
Well, I mean, I don't think it's a perfect way that the Republicans are doing it. You know, there's a repeal and a replace. The replace is 2 pages long that lists some goals. I wish we could have actually had some real concrete solutions that we were replacing it with. But at the end of the day, you know, we held town hall meetings. My district was very opposed to the bill. I voted against it. So I don't see why, you know, if you voted against a bill, if you think it's bad, why you don't want to repeal it. There are provisions in the bill that I do like. I think it's important that we don't discriminate with folks who have pre-existing conditions. I think it's important that you don't drop somebody because they get sick. Keeping children on insurance until they're 26. There are good provisions, but overall, there are a lot of tax increases. There's a lot of new spending.
First of all, it's just simply a bad bill. It's fiscally irresponsible. It's unsustainable. We're taking $600 billion out of Medicare to finance this on paper. We'll never take that money out, and so I think it's never been based on sound economics. Second, it's a job killer. There's no question that a lot of the slow growth in jobs are small businesses refusing to hire because they see this enormous cost coming on them. And finally, I do think it's an intrusion on individual liberty. Look, I think everybody ought to have health care insurance. I think that's a responsible thing to do. I'm not convinced the government constitutionally can order you to do that. So I think this bill fails a lot of tests. I voted against it when it was passed. The sentiment in my district was very strongly opposed to the bill. Frankly, I'm very proud to begin the process for repeal. Now, that's going to be a hard struggle, but I think it's also a matter of a new Republican majority keeping faith with the people that elected it, because there's no question the majority of the country opposes this legislation.
If the 2012 Congress is about keeping your word, probably one of the commitments made by virtually every Republican running for Congress in this last session of Congress was to have a clear up or down vote on repeal of what many people refer to as Obamacare. That's coming. I'm going to keep my word. I think my side of the room will keep our word. Who knows what the Senate will do? I suspect I know how the President will react, but at least the Republican majority in the House will keep its word.